Hey everyone, happy Thursday. Today we are in Ocean Springs on the Ortho Neuro floor, and we're going to meet some of the team members who have stepped up to help around the system during the fight against COVID, and also talk a little bit about Governor Tate Reeves' safe return order that he issued yesterday that will go in effect on June 1st. So pretty much that means all businesses can reopen as long as they follow the correct CDC guidelines relative to their industry. So that means that downtown we can have live music, but they have to be 6 feet apart or I guess it's 12 feet apart from the actual patrons there. I guess that's because when they're singing, they're exerting more respiratory droplets than most people. So that's something to look forward to. And also you can travel, schools are able to have in-class sessions. So there's some good things going around, but I'm gonna kick it to Lee to kind of explain what that means in the healthcare world.
Sure, and I like the this safer return. I didn't like the misnomer of safer at home because, as we've said all along, I don't feel you're safer at home. People are actually safer in the hospital than they are at home. We've learned from our contact tracing that people get it in their home. So if everybody was working, I swear I think we'd have less COVID positives. Speaking of which, in conjunction with this, we have 0 positives today.
That's awesome.
We did do a special testing program at the fairgrounds today, and I think we tested 115 people. That's going to put us over 4,500 tests performed through today. So again, we will continue to emphasize to people to please, especially while you're at home, wash your hands, don't touch your face, don't hug people, don't shake hands when you're at work. Continue to keep your guard up. That's the thing, people at work tend to keep their guard up. Keep your guard up while you're at home and while you're at work. But anyway, so hopefully we'll little by little get back to business. But let's flip it over to Caroline.
Hi.
And if you would, tell us a little bit about what you guys do up here, a little bit about your team.
Sure. So True Northwest is a 29-bed ortho neuro unit. So we get all of the elective orthopedic surgeries, hip replacements, knee replacements, spine surgeries, any bone traumas that require surgical intervention or stabilization, those patients come to us. We're also the primary stroke unit for the health system, and we are a DMV Stroke Center of Excellence. Although ortho neuro is our subspecialty, we are part of the med-surg family, so we get all medical and surgical patients.
So how are you guys doing now with, for a while, you didn't have hardly any patients, right? But now it seemed like yesterday you were as busy as you were busier than you were back in January. It seemed like to me this morning.
Yeah, that's right. So our floor is typically very busy, especially with all of our surgery patients. But whenever COVID, arrived here in South Mississippi, of course, we saw kind of a halt in the procedures that we could do. And so our census did drop a little bit, but we have an amazing group of staff. They volunteered, some of them volunteered to help on the COVID unit. Some of them have gone to ICU, HR, infection prevention. They've shown wonderful grace.
Because I saw you on the COVID unit.
I was.
Over there too, so.
I was over there as well. Although we're 2 different hospitals, we're very much a family, and so we help each other out. But our surgical volume, since we got the green light to start procedures back, have skyrocketed, and we could not be happier. We are so happy to be busy. Absolutely, absolutely.
Your team is not just nursing and doctors; it has a lot of other members too.
We do. So, of course, we've got the best surgeons around and the best nurses around, but there are so many interdisciplinary teams that really make our unit a success. Or we've got our occupational therapist, our physical therapist, speech therapist, dietary, EVS, case managers, everybody's working together.
Takes a team.
That's right. That's right.
It makes sense why you guys were one of the first to jump on board when we needed some other team members to deploy over to Pascagoula to help out with the COVID units. So we thank you very much for that and for being team players as always. And we have Abigail here. She's one of our newer nurses. She started back in January, right when this all began.
Yeah.
So what has been the most inspiring thing I think you've experienced here with us?
I think for me, the most inspiring thing is just seeing how great everybody works together and how vital each and every position is, from the people who come and clean up the rooms after I discharge a patient to the people that bring the food. It's so awesome to me how everybody works so well as a team at this hospital, and that's something that really drew me to Singing River Health System, is just the amount of teamwork and how everybody works together. And I can walk down the hallway and say hey to a doctor and he's gonna say hey back, and I feel comfortable doing that as a new nurse. So
You made my day. It's a core value for us. It's core value 6.
Yeah,
Teamwork always
My
wins.
favorite.
Yeah.
Yes, that's
Absolutely.
you made my day.
So
You
what
know
about
we
you,
love that.
Caroline?
That's what we're trying to do.
Were you nervous to go over there? Because you managed that COVID
I did.
floor for a
I was the
minute.
relief manager on the COVID unit at Singing River for a while.
You gave Jennifer a break every
I
now and then?
did. I gave Jennifer a break every now and again, and she deserved that break. She and her team have been working extremely hard. I mean, they truly are rock stars. You know, of course, there's like a little nerve when you go over, but the team was just so spectacular that like you walked in, it was like, all right, y'all, we're in this together. Let's just do it. And it was wonderful to see the quality safe care that we provided to those patients, really when they were in a truly vulnerable time in their lives. So, it was rewarding to see them recover. That was, to me, one of the defining moments was seeing a patient, you know, come in and then seeing them discharge home. It really is wonderful.
Don't stop believing.
That's right.
So
Don't
we
stop
play.
believing.
I'm very proud of you guys all for what you did there. Particularly, one of the things that a lot of people don't know is we took in patients from nursing homes.
That's right.
And I got today a great letter from a family member of someone that was so happy to hear that we did that. And as I talked to colleagues in other places around the country, their systems didn't always do that. Because I mean, who wants to take the COVID patients,
Right.
you know? But I'm so proud of our system for putting the mission first, and you guys being so fearless and being willing to do that. It really helped our community, and especially people that had loved ones in the nursing home, to know that they could come to the negative pressure rooms in the hospital and get the care from nurses like you guys. That meant a lot to our community. So thanks for doing that.
Absolutely.
All right, what else? I guess last thing I'll ask, tell me a little bit about the safety of being able to come in the hospital. And you know, I had a person just asked me yesterday, is it safe to come in the hospital? And again, I said, well, your place safe, cleaner than your house. But tell us a little bit from y'all's perspective. What that's
Well,
like.
you know, we are the safest hospital, right,
Number
in
one
the
in
state.
Texas.
And even if this global pandemic wasn't going on, this health system does everything they can day in and day out to keep their patients safe. Whether it's infection prevention measures like washing our hands, our EVS team is phenomenal. You know, we do everything we can to safeguard our patients, and that is why we are an A rating in safety. But again, it's not just during a pandemic. This is what we do all the time.
Every day.
Every single day, this is what we
Exactly.
do.
So don't let those things that could happen wait to come to our emergency rooms, schedule
Right.
your surgeries.
Take care of yourself.
Yeah.
We're safe.
And we're here, and we want to take care of you, and we know you have a choice, and we're just really thankful that you choose us for your health care, for
Yes,
sure.
And the team behind it is awesome.
All right. Well, you heard it from them. Stay safe. You're safe here. Wash your hands. Good hygiene. Brush your teeth too.
That's right.
And don't forget to do that. But other than that, stay Singing River strong.